Hi all, this is Dr.SHANTHI, Professor, EC Department, RMK College of Engineering and Technology. This presentation is going to outline what is meant by Pervasive Health Monitoring System. Now, first of all, let us look into what is meant by traditional model of care delivery. Now, let us look into the diagram. Now, when a patient is unwell, he finds out that he is unwell by detecting the symptoms. Say, for example, if a patient is having fever, based on the symptoms, he finds that he has fever. Now, what is the next step he will do? He will visit a medical facility, which means that he will go to a doctor. Now, doctor, he will inspect the patient, then he will come with the diagnosis. After the diagnosis, the medical representative or the medical doctor, he will carry on with the treatment. Now, this method is going to be called as traditional model of care delivery. A healthy populace is essential for societal prosperity and well-being. This makes healthcare a basic societal necessity. The current mode of delivery care relies on the patient initiating the care delivery process, and that is going to be called as traditional model of care delivery that is shown in the diagram. No action is taken to improve the patient's condition unless the patient initiates the process, which means if a person is unwell, he has to go to the doctor. A problem with this approach is that it is inherently defensive in nature in fighting illness. The whole model of care was designed for a society where the number of people requiring care was a very small percentage of the population. The healthcare system in most countries will increasingly come under pressure as the average of their population increases and the number of elderly people swells. The meaning of this is, if the number of doctors are significantly lesser than the number of patients. One of the ways of reversing this trend is by the introduction of automated pervasive health monitoring technologies that can monitor a person's health and alert appropriate healthcare personnel in case of emergencies, thereby providing optimal care with minimal supervision. Now, this diagram shows or talks about the concept of pervasive health monitoring system. Right now, when we look at this diagram, this model shows that on a human body, there are a number of monitoring devices. These monitoring devices are sensors. They automatically detect the condition and they convey this condition, details about the condition, to a caregiver, right? And the caregiver can be another person at home or a person at work, or he can be a doctor at the hospital. Now, once the caregiver is informed about the patient conditions, then he talks about or he performs a diagnosis and he initiates the treatment. Now, the treatment is nothing but it can be a feedback mechanism where you have some actuators enabled taking place, or the actuators can give treatment in the patient's site. A proactive patient care form of care as opposed to reactive caregiver-centric form of today's care, which permits health problems to be detected and responded as soon as they occur. In the case of pervasive health monitoring system, the presence of an ailment will be detected well in advance before some or even any of the symptoms manifest themselves. This detection of ailment will cause the information to be made available to the caregiver directly. No personal visit is required immediately. The caregiver analyzes the data, performs the diagnostics, and specifies the treatment for the user, which can be provided to the user through a use of activation devices or may require the patient to visit the caregiver. The main advantage of pervasive monitoring system from the perspective of caregivers is that a single caregiver can now manage a large number of patients. Further, this can be done without any time or space restrictions for either the caregiver or the patient, which means that what is the meaning of this point is the caregiver need not be at the same place. He can be in a remote location and he can give the treatment to the patient without any time bound or space restrictions. Now this diagram shows a very clear conceptual view of pervasive healthcare model. Now here you have the patient fixed with various sensor devices. So the data collection takes place from various sensor devices, which we call it as device plane. Now what is the device plane is? You have various sensors for measuring, that is you have an ECG, you have a device for measuring SpO2, you have a thermometer, you have an infusion pump. So this is going to be called as the device plane. Mainly it is this device plane is concerned about monitoring health as well as actuate treatment. Right. Now once the data is collected from the sensors, it is automatically transmitted or it is being processed by a base control unit, or which is going to be called as the data access plane. Now the data access plane is going to comprise of either smartphones or laptops or some personal devices. Now what happens in data access plane is you have data management, data storage management, sensor data management, and information fusion. That is, you can gather or combine data from various sensors and an action can be made. Okay, right. Now from the action data access plane, the data is communicated to the doctor or the caregiver. This method or this plane is going to be called as knowledge plane, where you can have cloud-based services. Now what happens here is the patient health care or health state is diagnosed and the treatment will be actuated. Right? The doctor takes a full control or full he prescribes medicine based on the data collected from the sensors. Right? So pervasive healthcare model has a device plane, data access plane, and a knowledge plane. Right? Now from the knowledge plane, the doctor can activate the actuators that are present in the vicinity of the patient. So a feedback mechanism can propagate from the knowledge plane through the data access plane to the device plane, right? So the same thing is being put in words. The device plane is used to collect the medical data from patient and perform preliminary processing on it. It consists of a large number of medical devices that possess the capability to collect both physiological and ambient data from around the patients. The devices may be deployed on patients in both in vivo or in vitro manner. The data collected from the devices are handled by the data access plane, which serves three purposes: enabling the devices to interact seamlessly with one another, providing facilities for organizing the pre-processed health data from devices into a structured electronic format, which you call it as EPRs, electronic health records, or electronic medical records and for their long-term storage. Enabling device actuation as treatment measure. The data access plane also provides the infrastructure for managing the health data collected by the devices. The last plane is going to be called as the knowledge plane, and it is used for reasoning on the data in the EPS. Some of the features it can provide include detection of the occurrence of a medical emergency, the failure of a specific treatment procedure, and inconsistencies between the proposed diagnosis and the symptoms. This capability gives the caregivers feedback pertaining to their diagnosis and treatment, allowing them to make appropriate adjustments through the data access plane.